Doctors say more research is needed on perinatal depression. That's the updated way to refer to postpartum depression.
And as there's a stigma around even talking about women experiencing this, there's new research into men experiencing it as well.
As WRAL's Chris Lovingood reports, the research underway is not about removing women from the discussion.
There's only so much research that's been conducted into men experiencing postpartum depression, or PPD. But UNC psychologist Dr. Sultan Hubbard is trying to do more research to expand what's known about this.
It's a huge transition for the family as a unit, so not just mom, but also dad's significantly impacted.
And we're going to talk about dad in just a second, but we cannot talk about PPD without focusing on women first. Women such as Allie Cullen.
I couldn't emotionally figure out anything. I couldn't process anything.
Cullen is a mother in Wake Forest. She has 3 little girls, and she survived the dreadful experience that is PPD. Part of it was the complete opposite of the rosy, glossy lens Hollywood version of becoming a mother.
You've got this, beautiful baby that everybody, oh, it's wonderful having a newborn. And it's sometimes not. It's hard. So many people suffer with it, and when you're going through it, you feel very alone.
But you're not alone. In fact, CDC research shows 1 in 8 women who recently gave birth reported PPD symptoms. Therapy and a supportive husband, these are what helped Cullen.
And it can be as severe as people experiencing thoughts of harming themselves or others. And so those are the patients that we take care of on our inpatient unit.
Dr. Crystal Schiller is the director of the UNC Center for Women's Mood Disorders. She says the center is one of 4 inpatient units in the country dedicated to perinatal women with severe depression, anxiety, and mental health conditions. Women can experience a change in estrogen, cortisol, and other hormones during pregnancy, fueling anxiety and depression. Schiller says men can also experience a change in hormones, including testosterone.
I can understand that from the physical level as well as your moods.
Nathan Evans Jr. is a mental health advocate addressing audiences about mental wellness. He's a dad who says he experienced PPD when his son was born a few years ago.
First few weeks, I just felt extremely disconnected. I felt very lethargic. It was tough to get out of bed, and then obviously, you're sleep deprived, of course.
Evans understands. Some people are going to hear men experience PPD and think, really? When women are the ones carrying the child? Which brings us back to Dr. Hubbard's research into PPD in men. He hopes his work will provide change that will strengthen the entire family.
If he is not receiving any care and he's going weeks, months of experiencing severe depression or anxiety or irritability or fatigue or a sense of worthlessness, he's not going to be much of a support for his spouse or for the child.
He and his peers are trying to find the best ways to support families, including dads, and the best pathways to treatment. So no, Dr. Hubbard isn't saying steer the conversation away from women experiencing PPD. He's simply saying consider men in the conversation as well. For WRAL News, I'm Chris Lovingood.
There was a lot more information about this topic, including postpartum anxiety, that we just didn't have time to air. If you want to learn more about it, go to WRAL.com. We also have a list of resources for anyone experiencing postpartum depression.
Such an important topic.